Great mayor and the city council. Thank you, sir.
I'm on Medicare, but I would like to suggest that in changes to this bill or any follow-on bills, that a provision be allowed, incorporated to allow persons who wish to purchase their own insurance, whether it be catastrophic or otherwise. I am willing to pay something rather than to be totally dependent on the government. This is a follow-on to the previous Secondly, in whatever comes out of all of this, I would like to recommend that there be instituted a requirement that anyone receiving medical care perform or have a copay at the time of service. If one does not have to pay, then he is all too happy to spend somebody else's money. Thank you.
Appreciate the gentleman. I would add that I do believe that if you're going to receive something for free, you have a responsibility to take care of yourself. And that does not happen under the system today, and certainly will not tomorrow. Gentlewoman's recognized.
Congressman Sessions, I want to thank you for your firm stand against this bill and the infringement on our freedoms. I think there are a lot of people in this room that want to stand with you in this battle, and I believe that's what we have here, is a battle. I think that times are very urgent. It seems to me, I could be wrong, but it seems like there's a very narrow window of opportunity to fight back against this. And I think November 2010 is critical. I'm asking for those of us who want to support the Republican Party in the efforts to try to gain back control of Congress, what safeguards have been put in place to ensure that we don't support candidates like Didi Skazafava and other places where there are people who have not truly been a conservative as they have taken on the name Republican. I want to give, I want to go, I want to stand, I want to walk the neighborhoods, and I've never been a political activist, but I see the America that I love going down the tubes. But I need a confidence in a party that is only going to support conservative candidates and not spend a lot of money on those who are Republican in name only. Can you assure us?
Well, notwithstanding this is an issue that could be confined to a political gathering, I will answer your question because we're here for official business. As best I can tell you, that if you live here in Texas, if you live in this district, you'll have an opportunity to support someone that you say you would support. I would say to the gentlewoman this, that Scott Brown, who was elected out of Massachusetts, completely supported the Massachusetts plan. But after it became apparent what it stood for, he stated to the people of Massachusetts that he would go to Washington and vote against it. Some would say and could say, well, he was part of the problem. I think he was part of the answer. I believe every single Republican opposed the bill this time, and every single Republican would oppose the bill next time. And while I do not bind anyone, I let them do that themselves. I believe that the demise of the American people will very clearly see who will and who will not support changing, repealing, and rejecting this bill that is before us and replacing it with something better. It's my hope the gentlewoman would judge that as their word of honor. Thank you. Gentleman's recognized.
Pete, thank you very much for all that you do and all that you've done. I have read the bill. I have read the fix to the bill. I watched days and days and nights of all of you on C-SPAN. And I have to say,
now you know I look like I'm 70.
I noticed that you did have some veins stand out in your forehead a couple times there. I certainly understand it. But I want to say that you made an incredible stand for our party and for our country, and for that I thank you.
Yes, sir.
I'm convinced that we cannot afford this bill in any way, form, or fashion, but I'm also convinced, and I've heard not one comment from anybody on Fox or MSNBC or any of the trash stations or anybody that talks about how do you make this thing happen, because not only can we not afford it, but it is impossible for this system to be implemented in the United States of America today. It states that it must have technology to drive it, and that technology does not exist. It has not been implemented within our healthcare industry. I have been 40 years working in the healthcare informatics world. I understand we have no standards relative to an electronic medical record. The United States government does not have a system in the VA or in the military that provides this. There is only one HMO that's a fully integrated system that only has 13 million people that it really works. We have doctors all over the place with different physician medical systems to have to try to implement. In short, nobody has ever put 23 or 30 million people into a computer system and expected that system to talk to itself. We can't even run the database on Social Security without mistakes. We can't get the checks out that we don't have fraud and abuse in our own payment systems. I do not believe that this system, from a business person's standpoint, can be implemented, and if it were to be tried, the cost is in the trillions and decades to bring together the physicians and the services to make this thing talk together. And I just don't think it can be done.
Yes, sir. I appreciate the gentleman. In fact, I agree with the gentleman. I need to notify you that I have been asked. I agreed that we would do it here. The council was very nice. The mayor was very nice. City manager was very nice. We have now exceeded my time. Our next town hall meeting, and this happens on a regular basis, I'm very pleased with you and what we've done tonight. My next town hall meeting will be Wednesday, April 7th at Irving City Hall. I do thank everyone for being here this evening. I want to thank you not only for your conduct, I also want to thank the physicians who were here, Dr. Matthews for being here, Chrissy Gummer for being here. On behalf of myself, I want to thank each and every one of you for being here tonight. Thank you and God bless you.